Hey guys, before we start, a quick shout out to Alpha Dog Nutrition for sponsoring this podcast. Alpha Dog products are now available at dusupply.com, and you can use code ALPHADOG15 at checkout for 15% off and a credit for free shipping to try it yourself. Now let's get you to your podcast.
Welcome to my podcast, where we are going to talk about a lifestyle with dogs and throw in a few life lessons along the way. Whether you're a hound hunter, bird dog enthusiast, running setters, pointers, retrievers, or a flat-out running dog junkie, this podcast is for you. I am your host, Heath Hyatt, a certified law enforcement canine trainer with over 3 decades of personal and professional training and handling experience. It's time for me to pay it forward. So grab your leads, lace up those boots, and come and join me on this lifelong process of teaching, training, and learning. Are you looking to unlock your dog's full potential and give them the best nutrition possible for peak performance? Then look no further. Inukshuk has what you're looking for. Inukshuk's nutrient-dense formulas are crafted to keep your dog's energy high and performance top-notch. Packed with premium proteins and essential fats, Inukshuk delivers the balanced nutrition your dog needs to thrive. From hunting dogs to police canines, Inukshuk is trusted by professionals. Give your dog the power of peak performance with Inukshuk Professional Dog Food. Guys, with hunting season literally right on us, and I know the guys up north, I know Maine, New York, I think Vermont, I know Wisconsin, season come in July 1st, but for us southern folks, it don't come in until August 1st, and we are in a heat wave. I mean, I'm walking outside and I'm swimming in my own sweat. That's how hot and humid it is. So, sorry for you guys that's up north and northwest that I'm a month late on this, but I thought this was very important. So today we've got Dr. Garrett Bailey in the house.
Easy on the doctor there.
I thought because of the heat and the humidity, and every year we deal with this in our group, that somebody's dog falls out from heat exhaustion, heat stroke. We're going to touch on some snake bites and bees, because we've got into the bees a couple times going into trees or treed with bees in them. So that's the things we're going to touch on, and we're going to let Dr. Bailey kind of give us some information, some tips, some stuff to do and not to do. So our group is lucky because we have him with us, and if he don't do what we tell him, we just hog tie him and keep him in the woods until he does it.
And I'll stay there gladly.
He don't want to go back to work either, right?
Negative, Ghost Rider.
Not in hunting season.
No.
No, I'm banking my time.
I can't wait.
I'm banking.
It's ridiculous.
Yeah.
I cannot wait.
Well, I think we're all, but it's too hot. I mean, we talked about it.
I know.
It's 90-some degrees today. I did not pull the humidity, which we'll get into that in a little bit.
It's up in the upper 80s today.
Upper 80s? So way too high.
It might touch 90, yeah.
Oh, wow. Yeah. So, Garrett, how's everything I'm in your house sitting
It's
at your
good,
table.
man.
Yeah.
We're just having youngins, dogs running everywhere, trying to get something legal to drive for hunting season. A little bit different. I found out last year antique tags don't really cover you. You're just supposed to go to the garage or a car show, not be loaded down with hounds. But so that's kind of what we've been into today.
Yeah, I pulled up in the driveway, and I mean, dogs come out of the woodwork.
They're everywhere.
They come out of the trees, from out under the porch. 2 met me halfway down the driveway.
That's what Katie says. She says, someone's going to hit them. I said, look, ain't no one coming up that driveway that shouldn't be here because it is so rough. And everyone coming up here knows there are dogs and youngins running everywhere.
Well, when I turned the corner down there, I'm like, all right, Blue Dog, get out of the way. Get out of the way.
She'll move.
And then I pull up in the driveway, and Garrett's hanging out from underneath the Toyota. He's went sideways with the rest of the group. I am so disappointed in you, Garrett, for not going full size.
Oh, man, I'm telling you. The money.
I know. I get it. I just hope my old truck lasts me another If it'll get me through December, then I'll work on it some more and get me through another December.
I heard that. I got the backup. I got the old Nissan in case the Yoder breaks down.
Yeah. Well, I've got another one if I need it. I just don't want to use it. I don't want to tear it up. So hopefully old Rusty will
You dang right.
last me. It's going to, like me and Maddie were talking about this the other day. It's going, the truck that is going to outrun the body.
Right. The frame probably going to go. And
The bed, the fender wells and stuff are rusting so bad right now. And I just need to get some sheet metal and
get a good bed liner. They won't fall through that bed liner.
I've got one in it.
It'll save you.
Well, let me tell you about, and I didn't realize this. So when I was down North Carolina back in May, my truck was acting funny, and so on the way home, I called my garage, and I'm like, "Hey, this is what the truck's doing. Something's not right." I said, "I swear, I think it's in the front end." And he said, "All right, just bring it in when you get back." Well, I was hoping I could make it back because I was still 2 hours out from the house, and it was awful. So I get back, take it to the garage. He calls me 2 days later and said, "Hey, we got you fixed. You ready to go?" And I said, "Oh, well, what was it?" And he said, "Your shock mount had broke, and your shock was jamming."
Jiminy Christmas.
Well, I didn't realize it, but there's a shield underneath my bed, like a metal plate.
Was it resting on that?
Oh, it had almost poked a hole through it.
That's what probably kept it from flying off.
Well, and if I hadn't had that plate there, it would have went through the bed and probably got one of the dogs.
Jiminy Christmas.
So now I feel you. I guess all bear hunters, especially in this country, they're working on trucks basically during season.
Yeah.
It just happens.
It'll buff out's my motto until it won't.
Then
if you can't hunt, well, you got to have a backup.
That's right. I know, and it's so hard. I had to borrow my buddy's. I had to drive that Yoder around last year.
I seen you in it, yeah.
That was so painful. I mean, it was painful. Knees in the dash, driving a straight.
And it wasn't a four-door either. It was extended cab, wasn't it?
No. It was the old.
The old four-door.
It didn't have a door on it. It was
just extended. Right.
Yeah, extended,
like
but you had to you had to fold the seat up to get in the back.
Right.
Yeah. But thank goodness for friends because he helped me out.
Dang right.
But yeah, that was torture. That was the last week in the early season. So
yeah, I remember that day. I think we walked that bear up and down the creek. Was that day?
Mm-hmm.
No, it was a different day.
No, I was in there. Yeah, I was in there that day. Yeah.
I think that was when you had the Toyota.
Yeah. Mm-hmm. Yeah, I had it a couple days. So, but Garrett, like I said, I want to talk about this time of year is awful, and I want to make sure that everybody. I mean, probably at some point in time, if you've hunted any length of time, you've seen some type of heat exhaustion at least.
Right.
And I talked about this on a podcast maybe a month ago or so. I guess it was back end of June, 1st of July. We had a guy that had warrants. He bailed out and run it from his house. We pulled up. He took off running. Ended up doing a track with Pinot. And, I mean, this is twice that I've seen this happen with Pinot is when that back end starts going, like boom, boom, like he gets a little wobbly. And he don't get so big. I've not seen him get bug-eyed yet. But
right.
that back end starts going, and he starts losing,
get ataxic and weak. And
Yep.
Yeah.
And I really thought I had done some damage to him because I'm not going to say I was pushing him, but he just wasn't quitting.
Right.
Like he wasn't quitting.
Well, that's what we run into with these dogs.
Mm-hmm.
I mean, they ain't going to quit until they lay down. At least, hopefully, the ones we're toting around ain't going to quit till they lay. It's
right.
just it's in them to run to catch, and that's what we run into. But yeah, I can shoot through a few things here.
Yeah, go.
Try not to get too bogged down, but there's a difference in heat stroke and heat stress, and of course a fever.
Mm-hmm.
When we're dealing with heat stroke, we're dealing with a marked elevation in body temperature. It's actually defined as anything over 105.8, which is why it's very important to have a thermometer
with you.
I mean, have one in the box, have two in the box. I mean, have them at the house. They're very helpful with not just this, but anything.
Mm-hmm.
That's the thing here. We got so many. Katie, she's like, I think I'll go get another, and that's 100% chance that's been a dog's hind end or a cow's hind end. But anyway, so this triggers a systemic inflammatory response and multiple organ dysfunction over time. Once they get hot. And they're hot for some time. That's kind of what we run into, and it's just because their body can't dissipate heat effectively at that that temperature.
Well, let's talk about that real quick before you get into the medical terms, because you and I just had this conversation. And what people don't understand is, and if you're in a high humidity area, we looked at it and you said it was up in the high 80s today.
Right.
Temperature's 90 degrees, high 80 humidity. The dog sweats through panting. That not all, like humans, everybody knows this. Humans sweat, dogs pant.
Exactly.
When the moisture in the air is of that high quality, the dog cannot release that moisture through panting.
Right.
So, i.e., that turns into the dog overheating.
Right. And that's one of the 4 mechanisms we'll kind of hit on to dissipate heat. Evaporation, I mean, and that's how they're dissipating heat when they're this hot, because the other 3 methods just don't work. Mm-hmm. And we'll go over them. But the, heat stress is a little bit different. Both of these are a result of an external source that a dog can't escape. Just heat stress is 104. We define it as 104 to 105.8. Mm-hmm. And, this is before a lot of times you'll see the signs that we're talking about, like with Pinot. You might see a little bit of ataxia. The dogs are going to fall behind and they're not going to be right, but they're not to that danger zone. Mm-hmm. And the thermoregulatory, the hypothalamus, the set point's still the same with heat stress and a heat stroke, unlike a fever. When a dog has an inflammatory response, that set point's 102.5 per se. 99 to 102.5 is normal body temperature in a dog. So the hypothalamus, that's a set point that they drive up, to fight bacteria or whatever, a virus, fungal disease, whatever it might be, and even pain. With pain, that set point will go up to increase the amount of inflammation where they're injured or an injury. Whereas, that's not the case, of course, with heat stress and a heat stroke. But some risk factors, an ambient temperature over 89.5 is when, some heat loss from conduction, convection, radiation, and evaporation happens. And what that is, conduction, a way a dog cools is conduction. They lie on a cool surface, and that's like, you see it a lot walking from a tree. The dogs are all amped up, and after you get done screaming and cussing at them and they finally wind down, you're on your way back to the truck. And if you're like me, you're a little overweight and you're panting too, and you're wanting to lay down, and while you're resting, you'll see them. They're kicking leaves out. They're trying to get down to that cool soil to lay down because they transfer that into their body.
Yep.
Whereas convection is air blowing over the skin. That cools a dog. Radiation, and we're going to go over that a good bit because it's a big deal with this, is where they vasodilate. So, all of the blood flow that's generally centralized, whenever they have a heat stroke, their vessels get bigger and they move that blood flow out to the periphery. And that's how they kind of blow off a lot of heat that way, kind of through infrared heat waves. And then fourthly, and very importantly, is of course evaporation, which is done through panning. And the mucous membranes and everything kind of cool the air as it comes in, goes to the respiratory tract, oxygenates the red blood cells, and then the blood goes and perfuses all of the tissues and vital organ function. So that's the 4 ways that we'll be talking about. And when the air is humid, evaporative cooling doesn't happen efficiently or effectively at all. I mean, it doesn't work. So they're sitting there panting. You look in their mouth, they got that thick saliva, and it's coated all over their soft palate, and it's not working effectively whatsoever. So the risk factor, of course, is that ambient temperature, the humidity, and then what we're doing during it, of course. I mean, we're setting ourselves up for it. But it is what it is. I mean, we can hunt these next 53 days or what. Fortunate for the state of Virginia. Unfortunate. But anyway, we won't go there. Water availability, of course, is very important. Some things that decrease heat dissipation is, of course, the high humidity, confinement, and poor ventilation, which is something worth hitting on with dog boxes. I mean, when you put dogs back in there, I don't care how open it is. You got 4 or 5 dogs crushed in each side. You put your hand in there.
Yep.
And it's a big deal, and we'll hit on that, a little bit more here in a little bit. Obesity, underweight dogs that are out of shape.
Yeah.
I mean, that's huge. Prior heat strokes. I mean, once a dog strokes once, it's very likely to happen again if it is a true stroke. Now, I'm not talking about heat exhaustion. I mean, all of our dogs have heat exhausted. Yep. I mean, there's no way around it when we're hunting this time of year. But dogs that actually stroke out are very likely to stroke out again. So one big thing, too, is acclimation, or acclimating to the temperature. And a dog does that over time, but it takes time. And we see a lot of heat strokes. Like, we'll see a lot of dogs from West Virginia that heat stroke in the spring, and it's not real hot yet, but, you know, it'll be cool in the 60s, and then you might have a day that jumps up to the high 70s. Well, them dogs haven't acclimated yet. They go run hard, you know, make a tree, go to make another tree, and then they end up stroking out. It's because the acclimation process hasn't really happened yet. And it happens over a period of 60 days. They'll start to conserve more water. There'll be some salt retention. There'll be plasma expansion, and then their cardiac output will increase. And again, that happens over, you know, 60 days, which is another thing to consider. You know, how are your dogs housed? Are they, you know, out in the element? Well, you know, if they are, that's kind of good on acclimation, opposed to being inside or being in a cooler environment if they're in there all the time.
I just told my guys back our last training day, so this was the end of July, mid-July, everybody had their windows up, air conditioners running full blast. I pulled up in the shade and had my windows down and my air condition cut down. They're like, "What are you doing?" I'm like, "Because when I take that dog from that 60-degree temperature and I put him out here in this 85-degree temperature, it's harder on him than letting him sit there and work through it."
Exactly.
Like an old one of the first canine schools that I went to, the guy Robinson, I can't remember his first name. Robinson was from Tennessee, and that's what he said. He said, "Don't just keep. I mean, yes, when the sun's beating down and you're out in a wide open parking lot and you've got the heat coming from the pavement and the car, which mine's black,
right?
You know, yes, absolutely. But during those training sessions, I'm very cautious, or I'm trying to help the dog so I'm not hurting him in the long run."
Right. Yeah, no, that's using your head for something other than a hat rack there.
Yeah.
I mean, because you wouldn't think, you know, you're trying to keep yourself cool in the car, and then, no, absolutely. So there's two different types. There's an exertional and a non-exertional. You know, we see a lot of non-exertional too, just old fat bulldogs. You used to see it a lot in Mississippi. You know, they just go outside to take a pee, and the next thing you know, they're stroked out because they're brachycephalic with a smushed face and can't draw air. And but we're not going to go into that. Of course, we're dealing with exertional heat stroke with strenuous exercise. So just to try to hit on kind of the pathophysiology, I'll try to be pretty quick with it, but this just describes why things happen, how they happen. But you know, when a dog can't effectively dissipate heat, it causes inflammation, coagulation, and tissue disorders. So anything over 105.8 results in nervous tissue damage. The nervous system can get damaged. Now, it has to be there for a little bit. You know, you're talking, you know, 10, 20 to 30 minutes. It's not like they're going to touch that and all of a sudden, you know, neurons are going to start dying.
Right.
And as they climb over 107, we have cellular apoptosis, which is just where the cells start lysing and dying. And over 109, that's where you start to get neuronal death. And, you know, it's irreversible, and it stays over there for some time. You know, that's when you get the old brain damage or brain damage. And neurons die. And, you know, when a neuron dies, it's dead. It doesn't regenerate. And that's the same thing with a nephron. You know, a nephron is the cells that make the kidney up. Hepatocytes, which make the liver up, they do regenerate. But, you know, a lot of these dogs we see do go into kidney failure, and I'll kind of hit on that. But, you know, during the thermal injury, the physiologic response is vasodilation. So the central body temperature gets so high that the dog vasodilates to move more blood flow to the periphery, where they can, you know, achieve the cooling that we talked about earlier, radiation, and the infrared heat waves come off of them. So as it does that, it causes a hypovolemic state because all the blood's going to the periphery, to the extremities. Well, internally, the cardiac output increases, which keeps up with that. But then, you know, all this time they're sitting there panting ineffectively. They're just getting hotter, and they're getting hotter, and they're getting hotter. Well, eventually cardiac output decreases. And a normal physiologic response is vasoconstriction. And when that vasoconstriction happens, the blood flow can get to where it needs to go more effectively, i.g. the kidneys. 25% of cardiac output goes to the kidneys and the brain and everywhere else. So, but during a heat stroke, that doesn't happen. The vessels stay big. So these dogs go into hypovolemic shock. And at this point, you know, you're getting to the snowball effect of death. I mean, it's starting. So,
and what temperature is this?
This is once they've been. I mean, it can vary. Most of the time, you'll check them, and your thermometer won't even read it. I mean, they're that hot. when they're to the point where they're flat out and they're down, I encourage everyone, get a thermometer. And even after like a tree, just check their temperature. You can see which dogs are going to be more tolerant to heat and which aren't.
So let's look, maybe we're jumping ahead, but let's go over that real quick. I mean, I know we've all seen it or done it or whatever, but we're going to do it rectal. How long do we hold the thermometer in there?
So get a digital.
A digital?
Yeah. I've lost a few mercuries up some hind ends. Don't get a mercury. That's always an awkward conversation. Hey, we're going to have to get these OB forceps out and dig it out of your dog's hind end. But, the digital is kind of hard. So, yeah, stick it in there. I mean, you want to get all the way up until where you can read actually what the thermometer reads rectally. And, I always turn the thermometer on outside of the dog, and it's going to say 98.6, and then it's going to start flashing lines. That's when you insert it in the dog's hind end.
Yep.
Keep it in there till it beeps. Once it starts beeping, that's your temperature. And most of these dogs, if you do that, you're going to find that they're so high that it won't read. Hopefully no one has to do that. But I've always wanted to, and I never have, but it'd be nice on the days that, you treat to and it's noon and you knew you shouldn't have, and you get everything back to the truck and, pop a thermometer in all of them, just see where they're at. And age has a lot. The older dogs don't tolerate heat as well, that have had a lot of miles put on them either. And color, you're talking about the black car app. Black dogs will overheat a lot quicker.
Yep.
But yeah, so with the hypovolemia, at that point, that's something that needs to be addressed more so than we can really do in the field, and that's when you need to start thinking about, calling a vet or making some plans for that. But onward with what happens. So the neurologic system, as this heats up, though a lot of times they'll get over 112 to 115, and that's where a lot of times you'll see the neurologic signs. Like you'll have a dog that'll have a seizure, or you'll have a dog that's extremely ataxic, or you look in their eyes and it's like they're on a whiskey drunk. It's like your buddy. You look in them and say, he ain't there no more. We got to get him to the house. But they're collapsed, they're stumbling. What happens is the vessels, as they're vasodilated, the endothelium, which are the cells on the inside of them, are really stretched out, and they start to kind of die because they're hot, and they get edema, just fluid leaks out, and they get cerebral edema in their brain, and that's when you'll start to see a lot of the neurological signs. With the GI system, and this is, I'm sure everyone that has had a dog heat stroke or heat stress has probably seen this. I mean, last year on this table here, Koa, she was sloughing her whole intestinal lining here, and thinking, well, we eat on this thing, but we got to towel down. but anyway, so the direct thermal injury and poor perfusion to the gut, because all of the things centrally aren't getting perfused well, again, because of the radiation, the radiative heat. You'll see really bad GI ulceration. Oftentimes they'll start vomiting blood, and they'll start just blowing nasty bloody diarrhea. I mean, if you look at it, you can see their intestinal lining in it. And, they're sloughing the lining. And this is where we can get gut-derived sepsis. So, all of that barrier is gone. So, our GI tract's full of bacteria. And the bacteria will translocate, through the gut wall and into the vessels, and that's where they'll develop sepsis, and they'll go septic. And with the liver also, I mean, it's basically cooking. It's right in the center of the body, just cranial to the stomach, and it's very, very important in synthesizing clotting factors. And with worsening heat stress and a heat stroke, that we run into coagulopathies, which we'll touch on in just a second. But before that, the kidneys. So 25% of cardiac output goes to the kidneys. Blood is shifting from the dog's core to the periphery, and the kidneys actually sometimes they'll start bleeding because they are so underperfused and they're cooking.
So when you say 25% of the output, the cardio output, let's just put that in layman's terms. That means 25% of what the heart's pumping goes to the kidneys.
Absolutely.
Okay. I'm with you.
Yep. So you got to remember they're dehydrated because their panting's they're not effectively cooling. They're also in hypovolemic shock because all their blood's going out and trying to get cooled, so their kidneys are getting hammered. And that's where we see a lot of dogs go into kidney failure. If we save the dog, that's great, but a lot of times you'll recheck blood work and they'll be azotemic, meaning their kidney values are up. And sometimes they won't be azotemic because 66% of renal function has to be gone before we even see clinical signs on the lab. You know, their values will be normal if they got half of their kidneys are working.
I gotcha.
So, you know,
that's interesting.
Yeah, there's a lot of perfusion issues whenever a dog heat strokes, and the kidney is the one organ that we see that if dogs do make it, you know, there's a lot of lasting damage on the kidneys and cardiac as well. I mean, they'll throw cardiac arrhythmias. You put an ECG on these dogs, and I mean, it's wonky, real wonky, and you know, we have to treat those accordingly. And the heart also is cooking. I mean, it's in the center of the body too, you know, and it's having a lot of thermal injury as well.
So it's like, I mean, it's like they're cooking inside out.
They pretty much are. That's exactly what they're doing. I'm just basically describing what that cooking's doing to them, you know. I mean, and once, you know, sepsis and systemic inflammation, that's what ends up really getting them, is they go into multiple organ dysfunction syndrome, and they go into what we call disseminated intravascular coagulation. And the increase in the body temperature, basically they have anti-inflammatory effects going, pro-inflammatory effects going, and you know, there's a bunch of things that happen that are so in depth. Hell, I can't even remember what half of them are. But basically, you know, as this is happening, a thermal injury is going on, they can go in. A lot of them do go into DIC. And they just start bleeding. I mean, you'll pick their gums up, and they'll have what we call, you know, purpura and ecchymotic hemorrhage on their gums. They'll just be bruised, you know, and then their belly, they'll start developing bruising on their belly. And, you know, that's where, you know, all the time I'll have a conversation with clients and say, you know, look, what's our goal here? You know, this dog is maybe going to recover. You're going to have to, you know, be willing to be all in, and it could be thousands of dollars. And realistically, this dog's running days are likely over, you know, and not always, but usually. I mean, that dog will never perform like it did before it had that heat stroke, if it's that severe, you know.
Right.
But another thing with pain management, and a lot of people do this and have NSAIDs on hand, or non-steroidal anti-inflammatories like carprofen or Rimadyl, meloxicam, stuff like that we use when a dog gets beat up, and we all know you'll have extra and you have it laying around. It's contraindicated to give a dog non-steroidal anti-inflammatories that is experiencing even heat stress or heat stroke, because the liver metabolizes NSAIDs, or like carprofen, Rimadyl, you know, and the kidney excretes it. So if the kidney's getting hit and you're giving NSAIDs and causing the kidneys are, you can cause a lot of damage to.
So you're saying do not,
absolutely.
Okay, make sure I was on. I thought that's what you used some big word, Garrett, that I didn't understand.
Well, I didn't either. I just said it. but that's certainly a big no. You know, we use opioids, which, you know, are of course a controlled drug when they come in, because they are super painful.
Yeah.
But yeah, I mean, and that's kind of the nuts and bolts of a lot of the pathophysiology on what happens. There's certainly a lot that's left out, but you know, and now I think would be a good time to talk about like cooling the patient. So, you know, you get to the tree, or you have a dog that didn't make the tree, and you go find it, and that sunbuck is laid out and in rough shape. So everyone wants to go to the creek. Go to the creek and dunk him and just leave him there. I'm
guilty. I've done it.
Well, I mean, and the thing that I always tell, you know, other veterinarians is, because they've never been in that situation, it's like, you know, we're in the woods. We don't have access to all the things that you think we should. We don't have it. So, but, you know, whenever you dunk a dog and you leave them in the creek, they can't dissipate that heat, you know, that we were talking about with radiation. I mean, and they're internal
sauna,
and you're keeping the heat in. You know, you're actually making it worse.
So let's back up a second, because I've had this happen to two of my dogs in the past. When I get in there and I realize that this dog is having heat issues,
right,
and I don't know if it's exhaustion or stroke or whatever,
right,
is it best for me to try to carry that dog out? Or, like, one dog I carried for a while, but she was bigger.
Right.
You know, she was a bigger female, and I was a mile and a half in.
Yeah.
I had 3 other dogs with me, so I carried her. I'd make her walk. I'd carry her. I'd make her walk. And literally, she was down for a year before I got her back right. And you were exactly right. The heat, she never did right in the heat again.
Right.
But anyway, so do I need to think about? And a lot of these upland websites have like a sling that you could put in your bag. It's small. Right. It rolls up. I mean, it's smaller than if you rolled your sock up. Is that something that I should be looking at, or what should I do with that dog?
So if it's a heat stroke, you won't have a choice because the dog, you're going to have to carry it or drag it, because it's going to lay there. But with heat exhaustion, I'll look on the Garmin and see, where is the closest water. Because if I got a mile and a half to the truck dragging 6 dogs, and water's 200 yards, I'd be tethering dogs to trees and taking that dog to water. And when you go to water, you want to work the water into the dog's coat and its fur. You can cup water. It's actually they cold water causes vasoconstriction, right? And which that is
contradicts what you want to do.
What you want to do. So if you read a textbook, you're supposed to use room temperature water or hot water. Well, that's real practical out there in the bush, So the best thing to do is kind of cup water out and just cover the dog. Rubber belly, rubber feet, rubber legs, rubber back, and just get them wet, because that's going to help dissipate that heat. And then as you're walking out and air's blowing over, it's going to cool the dog. And that's really all that you can do in that situation.
And that's heat exhaustion, not heat stroke.
Well, and even with a heat stroke, it's all you can do, But with heat exhaustion, it's good to do as well. But
I thought we were supposed to stay away from water because we were making it worse.
Well, so you're not wanting to dunk them and leave them in the water.
Yeah, just make sure we clarify that.
Yeah, getting water is good. Letting them drink is good. Water availability is super important, especially once you get back to the truck. These dogs that are exhausted, they got to have water, But with a dog that's heat stroked or heat exhaustion, water is good to put on them. But you just don't want to submerge them in water.
Okay.
You want to wet them and work the water in. And then what we do at the clinic is we put fans on them. And I had mentioned alcohol when we did that. That's baloney.
So that's changed.
That's changed. And that's the thing about veterinary medicine, man. It changes. I mean, we might have something new next year right before training season that we find out. But the alcohol theory that causes vasodilation has actually been disproven, and has said that it can maybe be worse for them because they might take some of that alcohol up in their bloodstream.
Oh.
So that's no longer recommended.
Okay.
But yeah, so you want to get them wet, and then you just got to get them out of the woods, and at that point, they need to be in the truck. You need to have the AC full blown. If the old truck ain't got no AC, I'd put her up on the rig rack and I'd make time.
Yep.
And get to the vet, especially if it's a valuable dog. And with the heat exhaustion, and you should know this because hopefully you have a thermometer. If you get back to the truck and they're 106, 105, 106, they're still getting around. Get them water, you wet them down, put them up on a rig, cool them off, put them in the truck, and then recheck their temperature in 30 minutes. But yeah, so get them on the rig and get them going and get them cool. And then recheck their temperature in 15 to 20 minutes, or whether they're in the vehicle or what. And there's a few things not to do that a lot of people want to do. Don't ever soak a towel and put it over the dog, which you think you're doing good because the towel is cold, but you're actually not, because it's holding heat in, and heat
like a
can't
thermal
dissipate.
blanket.
It really is.
Yeah.
But it's crazy how many dogs will come in that have been covered up in a towel.
Oh, wow.
And, it's just it's essentially a blanket. But yeah, so the checking and rechecking the temperature is extremely important, even in heat exhaustion dogs, because these dogs will be cooling down and they're going to reach 103, and that's kind of the number that you quit trying to cool a dog off, because their hypothalamus gets jacked up during this time anyway. Their brain was cooking at one point,
Right.
So they'll actually get hypothermic. You'll recheck their temperature, and the next thing you know, it's too low for the thermometer to read. And that causes a whole, you're starting to get to the point where you're peeing up a rope when that happens. So even in the clinic, when I'll, a lot of times lavage these dogs. I'll stick a hose up their hind end, and I will give them just room water temp enemas and just roar. But you got to watch. I mean, because you can get them too cold too quick, and then that's a whole nother bag of worms. So 103 is kind of the cutoff that you want to quit doing what you're doing, and reassess the dog. How is he doing now? If the dog started having seizures, another good thing to keep in your box is K-Rose syrup. I mean, these dogs will get hypoglycemic.
Yep.
I mean, their blood glucose will drop. So, if you're on the way to the vet and the dog is neurologic and you're looking in his eyes and he ain't looking back, no one's home, he's had a seizure, or they're stumbling around, rub K-Rose syrup on their gums. Do not pour it down their throat. Just soak your finger in it, and they'll absorb it through their mucous membranes. Another good thing and this hasn't been proven yet, but I had a sport dog client. She's actually a veterinarian as well. I tried to call her to find out some information on this, but they were doing a study where they actually open their mouth and have like a ketchup bottle with water, and they spray off their soft palate, because if you ever look, their soft palate's so gooked with thick saliva.
Mucus,
They're saying that might really aid in helping them cool as they're panting. But I wouldn't recommend doing that, because I don't know if it works, and, you don't want to waterboard them, obviously, get aspiration pneumonia. We're going to get him cooled off, but damn, he's got pneumonia.
Yeah.
But, and then once these dogs recover, even the heat exhaustion dogs, it's very important for them to get some groceries in them, because, as the GI system, even if it got a little insult, he might not be sloughing his lining, but he's probably going to blow diarrhea. And he might even blow diarrhea for a day or two.
Yep.
Get some wet food, boil some chicken, some white rice. Don't be making no bacon or anything like that. But, get them something bland that's easy on their belly and get them eating. That really helps a dog out a lot when this happens, is getting them back on feed quick.
So I've got a couple questions for you. And I've been told this, probably throughout my hunting career. So just making sure it's still a go or no go. Like, I carry Gatorade with me in my car for Pinot, because it's got the electrolytes. And it's got some sugar in it.
Right.
I will mix that with his water sometimes. And of course, that dogs are treed. They have the glycerol that's already pre-mixed.
Yeah.
Hydrate 101, and it's they already have it. It's a great product. I used it last year, and I didn't see some of the problems that the other guys had. Right. But again, y'all were running a little bit harder than I was too. Like, I wasn't dumping it. Well, 12 o'clock in the daytime, smart. Garrett.
Man, when they cross the road, I mean, what are you gonna do? You got to dump a box.
I got mine padlocked at 10 o'clock.
I got so many dogs around here, by golly, I got to run them.
So
no, but that's the way to be. That's what I preach. But man, sometimes I struggle.
Yeah. So I have Gatorade. Of course, I use the glycerol. I used it last year in my water before every run.
That's a great idea.
Up till mid-September, and I think I slacked off. A lot of us have significant others, wives, girlfriends, whatever, that are nurses.
Right.
I've got, and I got this from you, but I carry a couple drip bags with me now.
Right.
Of course, I've got you with me 90% of the time, or somebody that's in the nursing field that can pop that in between shoulder blades and roll with it.
And that's something that, in a heat exhausted animal, it's sub-Q fluids are never going to hurt, but in a true heat stroke dog, you're peeing up a rope.
Yep.
With all the things that we just kind of went over, they need an IV catheter and shock doses of fluids. And, that's what they got to have if they're going to make it. But, I mean, you don't want to set on those dogs. I've had clients that have done, I've seen a lot of good dogs die that, they'll heat stroke at 10 and they don't want to call. This is back before I was working emergency medicine. They don't want to call, or, they think the dog's going to be all right. And then, 4 o'clock in the morning when he's still laterally recumbent and, his intestines are falling out of his hind end and, he's looking comatose, it's too late. At that point, we're done. I've had a lot of them die on the way in, It's like windy heat stroke.
But that goes back to the having a thermometer. Like that's a $2.99 fix.
Yep, right there. Like, I mean,
there's no excuse for us not having a couple of those laying around in everybody's vehicle.
Absolutely, and they're so handy too. And being a dog man and dealing with your dogs when they're off, they're sick, they're not eating, check their temperature. I mean, there's so much. I have a buddy, and when he gets a dog tore up, and it's not bad, but it may be, he's debating on taking it or calling about getting it sewed up or something. He'll check their temperature, and if they marinate overnight, that's the first thing he does in the morning, because again, that set point with inflammation changes, like we were talking about. The difference in a fever. A dog that gets tore up pretty bad, they'll develop a fever.
Correct.
And he'll check that next morning. And if it jumped a degree, he'll be coming. And there's a lot of value in taking a dog's temperature.
Yeah,
a lot of value.
So let's talk about the box. I don't remember where I was at, but this has been probably a good 15 years ago or so. Oh, we were up north hunting, midsummer, July.
Right.
Hot. And in New York, you can't turn loose after it's 80 degrees.
Oh, really?
Yeah, you cannot. But we had a hard run, caught the dogs up, and one of my buddies was with me, and we were in two separate vehicles, and we stopped at the gas station. I said, "What are you doing?" He said, "I'm getting a couple bags of ice." I said, "Bags of ice?" He said, "Yeah, I'm going to throw it up in the dog box." So he literally got 2 bags of ice, left them full, busted them, throwed them up, just the bag and all.
Right.
Laid it up in there, and man, them dogs was like laying right against it, cooling.
Right, right.
And I've done it since
right.
I seen him do that. Of course, like I said, that was 15 years ago. So, what are some like my box is not as open as you guys. Mine's got the slides on it, and that's it. It don't have rig holes or whatever.
Right.
But at the same sense, I never have more than 6 dogs in my box.
That's a big thing there. I mean, and putting them on the rig when they get like that is because, you're achieving, the airflow and convection cooling is happening, as you're driving down the road and they're on the rig. They're going to cool off a lot more effectively. And then conduction, dissipating heat, talking about lying on a cool surface. That's exactly what them dogs are trying to do when you throw the ice in the box, but you have to be careful. If they're just exhausted, that's fine. But if they're truly heat stroking, that's a whole different deal. But yeah, that's a great idea with ice, and just having an open box, I think, helps. But I got 5 holes in each side of my box, and then the box I had last year had 3, and it got decent ventilation, but it's crazy when you stick your hand in there. You're like, gee, many Christmas.
It's a 10 or 15 degree difference.
Yeah, easy.
Yes.
And easy. And like you say, when you got 5 or 6 dogs in each side, they're cooking.
Yep.
And the other thing, I think we hit on a little bit, but, having a water box on the truck, and when you get back to the truck, even after the first race, if you tree one early and you want to go try to find another one, water all the dogs.
Yep.
And, that's extremely important.
Yeah. Yeah. So let's talk about out of shape. Because you and I talked about it before we walked in here. You was asking when I was going to hunt, and I'm like, my main goal for the next week, maybe 2 weeks, is to get my dogs out when it's cool, whether that be early morning or evening.
Right.
And just exercise them. I have no expectation of catching a bear. Now, like you said, one runs across the road and I can pack it up and it's not 100 degrees, absolutely. But
right.
I need to acclimate my dogs.
Yeah, and that I've been trying with my young dogs that, I can road effectively around here. I've been roading them. But there's a big difference in roading a dog and getting them in. That's a whole different deal when they're chasing a bear opposed to just roading and exercising. Now, don't get me wrong, it's certainly better than not.
Yeah.
But yeah, and these young dogs are a lot more tolerable, but you can make an old dog out of a young dog quick. I see a lot of these boys in West Virginia. They run, they catch a lot of bear and run all the time. At 6 years old, that dog's old. They're not going to have a 10-year-old dog.
Yeah.
Because they're either going to move it on when he's 6 because he's slowing down and he's not contributing, or he's going to die.
Yeah.
Because of just the wear and the tear.
Yeah.
But yeah, that's the thing is getting them in shape, running them, and then feeding to condition. Man, that's a huge one. I always get people, how much do you feed? Well, every dog's different.
That's right.
There's a body condition score chart that, it's 1 through 9, and 1 to 3 is underweight, and 4 to 6 is what we consider ideal, and 7 to 9 is obese. And, I got some dogs that eat twice what other dogs eat because they run the chain off. They're idiots, but they run hard and they do what they need to do to keep sticking around. But you got to feed that dog different than that dog that has a little bit more sense and lays around in the box and he's not, and then all their metabolisms are different. So feeding to condition and having a dog, fit is very important as well.
Yeah.
I mean, really, really important.
Yeah, I cut. So Pino, about mid-May, towards the end of May, I cut his food back, and he looks really good right now. You can almost count the last 3 ribs, like
right.
Almost. You
right.
can see 2. It depends on how he's standing or turning. You can maybe see the 3rd one.
Yeah.
And all my canine guys, they're like, man, you got that. I'm like, it's summertime.
Yeah.
Any extra weight is putting extra burden on him.
Absolutely.
Y'all guys, I mean, they got these GSPs, and I'm like,
fattered mud.
Yeah, they need to go on a diet.
Yeah.
Like, come on. Like, you can't operate in the heat like that. But I also understand that if my dog's overweight and I try to cut his food the week before season, and then I put that burden shock on him for running him, I'm just making it worse too.
Yeah, I assess them every time I feed them. When I feed, as you see, all my dogs are on chains for the most part, and rock or dirt, and I pick them their feces every day, and I look at them.
Yep.
And if they're starting to see a little bit of the top of their hips, or they're getting a little ribby, or maybe they're getting a little too fat, and I put my hands on them too. I feel what kind of fat cover they got. I got one crossed up dog out there. If they all ate like that, I'd just cut my feed bill in half. I feed her half of what I do every morning, and she stays fat.
Right.
She stays in good condition. So every dog's different.
That's right.
And feeding to condition is important. I like to see them going in like this time of year at about a 4 to a 5, a 6. I think is too fat. But now 6 is normal. It's a normal. 4 to 6 is normal. But I like to see the last couple ribs but yeah.
Yeah. So let's talk about bees real quick.
Yeah.
So I've been in. This happened to me a couple years ago. Went into the tree. The dogs were off the tree, and I couldn't understand why. I'm like, well, are they going? They're barking. Like,
right.
Well, I go in, and I'm literally standing right beside. I'm standing in a yellow jacket's nest. They start eating me up. Man. The dogs had several stings on them.
Right.
Is there something I can do? Is there something that I should do to maybe curve that?
Yeah, diphenhydramine, Benadryl. That is it. It's an antihistamine. There's a huge histamine response when a dog gets stung by bees. I see them all the time at the emergency clinic. They'll come in and their muzzle's swollen. Well, we don't know what happened, but was it a bee or was it a snake? Well, leave him here overnight and I'll watch it, and then I just slug him with Benadryl. I give it under the skin, give it a shot of Benadryl, but a pill works just fine, and it's 1 milligram per pound.
Oh, I was going to ask. That was my next question.
Milligram
How
per
much?
pound. So, a 50-pound dog gets 50
milligrams,
milligrams, which it comes in 25 milligram tablets. So that's 2 tablets, and you can do it as often as every 8 hours. But, generally, it's very, very rare to see a dog come in that's been stung by bees that needs much more than that.
Right.
If there's a fair amount of swelling around the airway, then we might reach for some other things, but usually there's not. Their muzzle will swell up, and even around the airway, sometimes if I know it was a bee, I'll just do the Benadryl and I'll kind of keep the dog overnight and just monitor it. I actually had one 2 nights ago. Had a bunch of swelling down around its throat latch there, under its chin, and the guy was kind of worried about it being a snake, and he didn't have money for anti-venom, and so we kept the dog, and after Benadryl, within 3 hours, it looked a lot better.
So let's talk about the snake bite real quick. So we know Bryce done a podcast. You guys, if you hadn't listened to it, Deep and Lonely with Dr. Bronx, and he has some really good information on there. And Benadryl was one of the things he talked about with the snake bite. So is there any other thing we should do? And I know you'll talk about the anti-venom, but
yeah, the thing, what we should do and what we shouldn't do. I haven't got to listen to that podcast yet, and I plan on it. But anti-venom is kind of the treatment. If you the AVMA, that's what they recommend, and it works. But a vial $650, and you got to have an IV catheter. They got to have IV fluids. They're hospitalized. I've had dogs that have taken 3 vials before. And And, the truth of the matter, if a dog gets bit by a copperhead in the leg or something like that, it really depends on how much venom they get. A lot of those dogs, that whole leg will blow up. It'll get very swollen. And, I'll have people that say, hey, and I mean, I'm one of them. If that's a young dog and he got bit and he's not doing a whole lot, well, I mean, I'm not about to spend $1,200 to give him anti-venom. I mean, I'm just, we got 3 kids running around here and student loans and bills like everyone else. But, steroids and antibiotics actually by the AVMA now are contraindicated. Now, it's not a perfect world. I'm not going to sit here and say that I've never give steroids to a snake bite because I'm not a liar and I'd be lying. But, as far as recommendations, Benadryl is a big one. A milligram per pound every 8 hours. And then I would recommend just reaching out to your local vet. If it's more than that, anti-venom's not an option, and getting some advice or taking the dog in to be seen.
Right. Well, is there anything else that you think we would run into during the early season right now when it's hot, foliage is out, all the creatures are out messing around? Is there anything that you think we skipped over?
Not necessarily. I think that's kind of the 3 big ones. I mean, other things we can hit, any time of year with just injuries and, but I think those are kind of the three big ones that we're going to see this time of year, at least that is in my head right now. So
let's recap that, and then I'm going to ask you a question. We're going to wrap it up.
All right.
So thermometer. Guys, there's no sense in not having a digital thermometer.
I have a few of them.
Yeah. Okay. I mean, I'm going to, when I get to work tomorrow, I'm going to go buy me another one. And I have the old one, so I'm going to upgrade.
I'm telling you, I literally lost one up a dog's hind end one time.
Yeah, no.
I turned around to write in a chart. I was in high school and turned back around, and it was gone. I mean, the thermometer was, we had to go fishing.
Yeah. One of the things that I learned from you last year, which I've invested in, is a good set of clippers.
Right.
So I'm doing that.
Yeah, no, that's extremely important. Yep. I mean, golly, I can't beat that up enough. No. I mean, when people bring a dog in that got tore up 2 or 3 days ago because he's not doing good now, and the hair is literally matted on the wound and it can't drain, you've got to buy a pair of clippers. I mean, it's extremely important to get everything clean, get it flushed out, and to assess the wound. I mean, I can't tell you how many times I've had holes that end up, going into a body cavity, but no one ever really looked at it, and it comes in a couple of days later. It's like, well, yeah, I mean, he's herniated. He has to go to surgery. So,
and K-Rose syrup.
Yep.
Man, you can get that at the DG.
Yep.
And again, $1.99 hook you right up. So for $10, not excluding the clippers, but for $10, you can have what you need to make a good assessment and get the dog to help, i.e. the vet, or decide that my dog's not there, so I don't need to rush it.
Absolutely.
Yeah.
Without a doubt.
So Garrett, I'm gonna wrap this up. Tell me your favorite hunt last year.
Oh,
what was your favorite one?
I had a lot of them, but it was probably that bear I killed in the hole.
And we went back 2 weeks later and caught another one in the hole and brought you your shell casings to you.
Freaking awesome. Oh, my gosh. Walked in ahead of a holler, and the only dog I had that was reliable at the time, and still kind of the only one, started opening, and some of my young dogs took off, and, I mean, they were scalding the earth and kind of left her. And, I thought they were trashing, and they ended up kind of pulling over into a big old holler and catching on the creek and walked for about 30 minutes and ended up treeing. And Brandon Thompson, old Glade Creek Kennels, he was with us that day, and he ended up packing some dogs in, and then old Hot Rod, old Sambo come, and he packed some dogs in. The bear come out, and it tore a few dogs up and ended up getting in a hole, and I was going up there, and, I mean, I'd done decided he was dying. I mean, Brandon had seen him and seen he was a good bear, and we got in there, and I was walking up through there. I mean, I was tore up like a can of sauerkraut, and Brandon said, Garrett, "You dropped your magazine." And I turned around. I had one bullet in my pistol, and the whole 15-round mag was sitting there on the ground. So I got that, and I'm glad I did. And, man.
We are duct taping and Velcroing your stuff to you this year.
I'm telling you, man, it would have been rough if I would have had one round because we'd have been turning back on him. I mean, we got in there, and Wormy, Sam's Mac dog, a couple of the young dogs out of Spook, and they were in the hole. And, he was in there luckily he wasn't a mean bear. I mean, he was terrible, he wasn't mean, but,
right.
I mean, he tore some dogs up, but, we got, Wormy don't have a tail, and he was the last dog I pulled out, and, finally got him out, and his jaw was kind of hanging off where he had locked jaws with the bear. And the bear come out, and I was feeding them to him, but I got 15 rounds for a reason. I can't shoot a pistol worth a hoot. And
they said, Hot Rod said, got a little Western up in there. And I was like, was Wesley there or was it Garrett?
It got real Western. And he ended up deciding it was a better idea to back out of the hole, and that's where he messed up. He got in behind them ribs and let her purr, and we killed him. He died right there. About 250. I mean, it was a good pretty boar bear.
Yeah.
And man, it was a good time.
Yeah.
I'm ready to make a lot more memories like that. I don't really care to kill them, but a situation like that. I mean, don't get me wrong, I like killing, but but that's not what it's about for me. It's about the dogs. So
well, I killed one last 2 years, and I have no desire to kill one. I still don't even know why I pulled the trigger.
Hey, that situation, I don't know how you wouldn't have.
Well, I mean, I didn't have nowhere to go. That's for sure. It was going to have to be me or him.
I can guarantee you he'd have died if I'd have been there.
I'll tell you one on Garrett. Like I don't remember which hunt it was. Oh yeah, we Jeff Shetler was in, and his wife and daughter were with us, and we had treated a bear, and anyway, we're hauling ready. Garrett was up in the holler way above us, and we were trying to tell him where we were at. Well, Garrett's dogs kind of filtered in. We tied them up, and we had already taken the bear, got it back to the truck, and here comes Garrett. I mean, literally popping out of the brush, like it's like Moses parting the water. The laurel thicket opened up. Here comes Garrett, and he don't have a radio. He don't have his Garmin. He's lost his phone.
The bear's dead.
He don't have a hat. And I'm like, Garrett. And he's like, I lost everything coming down through there. And that's why we kind of poke fun at him, tell him we're going to Velcro and duct tape him and tether everything he's got this year.
Everything but my sole and my boots that day. I mean, it was gone. I luckily found the Garmin, but it took a while. The radio's still down in that holler somewhere.
Yeah.
And that's the first time I used that radio.
So that's why I got mine tethered.
Hey, I had a dang bino case that I was using, which was stupid. And I got to crawling through, the laurel. And everything come undone several times. So I got a new setup this year. I mean, I'm still going to lose a lot, but hopefully it won't be as much.
Don't use the Sitka binocular pack.
Do not.
Because it will not hold your equipment.
Simply fact, not fiction. And if anyone wants one, I got one for sale. I mean, I'd even give it to you.
Yeah. To upgrade, right?
I done upgraded, but I still got that thing, and I do not need nothing to hold no binos. Not here in good old Appalachia.
Oh, Garrett, well, I appreciate it. Like I said, I'm glad. Hopefully this helps people out, helps people if they do get in that shape to make some really quick decisions and get the dog where they need it, when they need it there. Like I said, over the several years, I've had a couple dogs, and you and I just had this conversation about my old Jack dog. I honestly think that played a part in what happened to him. I really do.
There's cumulative damage happens from heat stress. I mean, It really does.
And it can show up 6 months later.
Absolutely.
Well, it's 4 months later for him.
Yeah.
So, yeah.
I mean, 100%.
So
100%.
Well, I appreciate your time, and thank you.
Yeah, man.
And we're going to get after him next week.
Simply fact, not fiction.
That's right.
Tailgate drops before the light. Coolers packed and the rig sitting right. Tracking collars charged, beeping green. Boots in the bed and the rifle's clean. Dog box rattling, engines hum. We're chasing bear till the day is done. Old Ring barking like he knows what's near. Nose to the wind, tail full of cheer. From the Virginia mountains to the Carolina clay, we're burning fuel and miles us each day. Every turn's another tale, through mountain mist and paper trails. We see the sunset red in Tennessee, rise through the fog in old WV. North Carolina's pines echo loud with the cry of a hard-run hound. New York forest, Maine's deep snow, Vermont valleys where the black bears go. Truck keeps rolling, wheels don't care. We're chasing daylight, chasing bears. Rest stops few, the roads are long, but the fire in our hearts still burns strong. Wisconsin mornings cutting crisp and clear, Canada's wildwoods drawing near. Still got states we ain't run, but that hound dog fever won't let us quit. We see the sunset red in Tennessee, rise through the fog in old WV. North Carolina's pines echo loud with the cry of a hard-run hound. New York frost, Maine's deep snow, Vermont valleys where the black bears go. Truck keeps rolling, wheels don't care. We're chasing daylight, chasing bears. Gas station coffee, Alpha XL on the dash. Another back road, another bear track. Friends made fast and stories told slow, under stars where only hunters go. We see the sunrise gold in Canadian air, and it sets on a trail down in Appalachia. Packing steel and leather, grit and care, we're built for the road and chasing bears. So load the dogs and slam the gate, there's a trail ahead, we won't be late. From dawn to dusk, we're always there, chasing daylight, chasing them bears.